So my grandma has diabetes and she's worried that her insulin shots are going to be painful. Are insulin shots painful?
I've heard from many of my patients that they're worried and fearful about having to inject insulin. They worry that it's going to be painful and difficult. Often after people try it, they realize this really doesn't hurt very much at all. Modern needles that are used for insulin syringes and pens are quite small and very sharp, and the pain is really minimal. It turns out that checking the blood sugar can be more painful than insulin injections, and once people get used to it, they really don't mind.
I have a friend with diabetes who says that she can't have any alcohol. Is it true, or is it a myth that people with diabetes can't have any alcohol?
Many people with diabetes believe that they shouldn't drink any alcohol at all. It turns out that drinking in moderation is okay if you have diabetes. And by moderation, I mean 1 drink or fewer per day for women or people 65 and older, while men up to age 65 can safely drink up to 2 drinks per day. It would be a good idea to check with your doctor and make sure that you don't have any other health conditions that might be aggravated by the alcohol, but overall it should not affect your blood sugar control, and it may have some health benefits as well.
I've heard that women with diabetes shouldn't have kids. Is it true, or is it a myth that women with diabetes shouldn't get pregnant?
There are women who have been diagnosed with diabetes before they've had a family and wonder if it's safe for them to get pregnant. Well, it turns out that women with diabetes can have a perfectly healthy baby. If you're thinking about getting pregnant and you have diabetes, it's best to work with your obstetrician before you get pregnant. It's good to get the diabetes under very good control, and you'll need to work closely with your doctor throughout your pregnancy. Women who have diabetes who are pregnant need to be very careful with their diet, check their sugar often, and some will need insulin to keep their sugars under optimal control.